Good afternoon, everyone, and welcome to this webinar discussion with Olly Cogan of Alphalake AI. My name is David Whitley. I'm the CEO and founder of 360 and 360 Immersive Experiences, and I'm delighted to be joined by Olly Cogan today. I'll just bring him up on screen. And Olly's going to be talking about his work with AI at Alphalake, and the sequence is going to be that I'm going to give a presentation with some of my views and questions about the use of AI within digital medicine, and then I'm going to hand over to Olly to give his own experience of the use of AI at Alphalake. Maybe with some comments and reflections on what I've had to say in my presentation. And then we're going to go into a discussion. We're going to go into a discussion about the use of AI overall. So I'm going to ask Olly now to unmute himself, and I'm going to ask him to tell us about himself. Olly.
Hi, David. Hi, everyone. Thanks for having me on your excellent webinars and sort of thought-provoking shows that you've been doing, David. It's a pleasure to be on here. I've enjoyed a few of them as a spectator, and yeah, enjoyed being an attendee. And I thought that particularly, so yeah, it's great to be able to share what we're doing and be a part of the discussion. So yeah, I'm Olly Cogan. I'm the CEO and founder of Alphalake AI. We launched 2 years ago, pre-pandemic, in the healthcare technology space, particularly to look at how we can use AI powered or enabled technologies to help transform healthcare, and so we launched the business at the beginning of 2019. So just sort of finished our second year. I previously ran a technology company for 10 years prior to that, and exited that to go into something which had a bit more sort of to use a popular term at the moment, a profit with purpose. And to try and do good with tech and healthcare. Little did we know how sort of even more significant healthcare would become. Yeah, we mainly focus on an area that gets banded around as intelligent automation, which I'll be talking about how intelligent that is and buzzwords and things later on. But that's the area that we focus on, which is to try and help predominantly the NHS, but we do have some global projects that we're working on to just be more efficient through mainly process automation or intelligent automation, just to join up and make healthcare more interoperable, but increasingly looking more at things like natural language processing and AI-powered chatbots to start to improve the UX, the user experience of those working in healthcare and who have suffered from not very good technology for too long. So we're trying to make a change there, and that's what we're all about in a nutshell.
Okay, thank you very much for that, Olly. I'm now going to share my own screen and a presentation that I put together with some thoughts about the role of AI and immersive technology. So artificial intelligence is something that is extremely new, but I'm not going to start with today. I'm going to go back in time, and I'm going to look at some of the fundamentals behind healthcare. I'm delighted that Olly mentioned the fact that his company is based around the concept of using technology for good. But if we look back at the clinical practices of bygone years, and these are not necessarily hundreds and thousands of years ago, a lot of the clinical practices were based around the fundamental concept of a doctor-patient relationship. And this is a cartoon that expresses probably one side of the doctor-patient relationship, was featured in a magazine going back to Victorian times. But medical intelligence, if we look back, before any kind of technology, we can see that human beings have been involved in medical practices since the dawn of time. And the relationship between the doctor and the patient has been absolutely fundamental to that. So it's this combination of human intelligence and patient intelligence, together with increasingly, as time went by, as we learned more about the human body, and we introduced a variety of tools to support the doctor in his diagnosis. So going back to ancient times, you can see that doctors were professionals who developed their knowledge through books, through dissection of corpses and a range of different things to give them the necessary experience to be able to understand enough about medical practices to be able to share their expertise for the benefit of other human beings. So technology, when it became available as a mechanism for actually measuring the vital signs of the human body, technology was used to supplement the doctor-patient relationship. And it provided tools for the doctor to use his skills and experience combined with the information that was provided by the technology and interrogation of the patient to get the way that they feel about it. This was all critical and fundamental to the way in which medical practice took place. So human intelligence in this doctor-patient relationship has harnessed dumb technology since the early days of the stethoscope. So for most of human history, our health and well-being has been managed by this combination of human intelligence in both doctor and patient, supported by technologies which provide the data upon which diagnosis and treatment was based. And human relationship between physicians and patients have been critical to health and well-being. So this technology enhancing the doctor-patient relationship has, until probably this century really, has harnessed the benefits of increasingly sophisticated dumb technologies to support the relationship, to improve the diagnosis and effectiveness of the treatment. So the characteristics of medicine before artificial intelligence were really based upon medical technologies that were essentially dumb. They were proprietary, usually, and generally unconnected. Health services, and I've heard this said by many different people, national health services were really national sickness services, and we only took advantage of health services when there was a problem with our body, we felt ill. And in order to provide medical services, clinicians needed to have a substantial amount of training and skill to be able to interpret the vital signs data. And patients were dependent on medical professionals to provide the support they needed when they were ill. And also, although it's maybe a side issue, it's important to recognize the fact that health insurance and the insurance model was based on the likelihood of illness, the length of longevity of lifestyle, basically on public health statistics. So I want to draw an analogy between the human body and the health of the human body and the health of human cars. And you can see how cars have evolved in my lifetime, from the 1950 odd MG that you see on the left to the car that I drive today. So imagine that our health has evolved as the way in which car health has been measured. So the human body is our vehicle that takes us from on life's journey from the cradle to the grave, and we know what the starting and finishing point of our journey, but we don't really have any idea of how long we're going to live or how long our journey is going to last, and what kind of health we'll have, and whether the route through our life is going to be easy or difficult. So if it's our body that takes us on this journey to our final destination, and our bodily condition determines where we are on that journey, what kind of journey it's going to be and how long it's going to last, most of us don't really know or monitor our body's condition or properly maintain it. And if you look at the cars before digital technology, and on the left-hand side, you'll see a Humber Snipe, which is the car my uncle used to have in the 1950s. He was the first person in our street to have a car. And it was totally reliant on the skill of my uncle and my dad when they maintained and tinkered about with the car before ever we set off on any journeys, topping up the oil, clean the spark plugs, etc. But we relied totally on knowledge professionals to fix problems when they arose. So as cars got older, breakdowns and the necessary repair became increasingly regular. So the consequence of this lack of technology was more breakdowns and reliances on these knowledge professional garages and mechanics to diagnose problems, maintain and repair. But as soon as we started to build in technology into the car, the sensor technologies, visualization technologies, modern cars have a lot of data measurement and visualization technologies built in. They can tell us what the oil pressure is, temperature, speed, range of petrol tank. They can warn us of impending problems, and they also help with navigation. And so this is an example of technology as an empowering and an enabling facility for human beings. So it's this combination of human skill and intelligence enabled by digital technologies that has improved the automotive industry that we know today. So what is the impact of these digital technologies, not on cars, digital technologies and AI, on medicine? Well, what's been happening during my lifetime, and certainly probably primarily during this century, is that medical devices have become smart, connected and more affordable. The diagnostics that these devices enabled by AI have enabled them to become more precise and reliable. Human intelligence is increasingly embedded in these devices so that they don't just give out a reading, they provide some interpretation of that reading. Patients then become less reliant on medical professionals. And one of the things that is been increasingly observed is the fact that when somebody goes to see the doctor or they go to see a clinical professional, they'll often come armed with a lot of data that they've collected by either measuring their own vital signs or reading up on information provided on the internet. So as time has gone by and AI has become more and more sophisticated, clinicians have needed less training, and they've needed probably a different skill set to the one that they've had really since the dawn of medicine. And also it's been observed that the focus has shifted from healthcare based on fixing problems towards preventative healthcare. So the consumerization of digital technologies had a big impact on those technologies, not only on those technologies, but also on who they're used by. So if we just look at the medical profession, we can see that if you go back in time, the technologies that were used by doctors and clinicians in early days, certainly for probably the majority of my lifetime, these technologies have been specially developed for the medical profession. They've been proprietary, they've not been intelligent, and they've been unconnected to anything. So when it comes to interpreting the data, it's often the data is written down and transferred manually by hand. But as time has gone by, we've seen throughout all aspects of society that technologies have become more generic, they've become smarter, they've become more connected. And so more and more citizens have been empowered by these technologies. So if you look at the kind of technologies that have been used in healthcare, the technology shown at the top, the doctor's bag with its stethoscope, the thermometer used by the nurse, the blood pressure machine, all of these were and still are actively used in medical practice, and they've been used for the majority of my lifetime. But over recent times, with the advent of smartphones, smart devices like pulse oximeters, fitness tracking devices, wearable blood pressure devices, digital blood pressure devices, and vital sign tracking equipment, all of these technologies have become now consumerized and are within the affordable reach of ordinary citizens. So this is a bit of a game changer. And again, to use a slightly different analogy, artificial intelligence has done an amazing job of empowering human beings in all kinds of activities. And what, in this example, it's a drone. You can see how small that drone is. That is a drone that I have and use to take photos and videos locally. These devices, which cost under £1,000, enable me to do what I think what would have been almost unbelievable in my youth. And certainly almost unbelievable until the turn of the century. Now we are becoming to accept these as the norm. And so what these AI does with something like a drone, it brings increased reliability in the sense that if I go out of range of the drone, it will fly back automatically to home. It knows how to stabilize itself. It's got loads of AI built into the drone. And what it provides me with, it gives me the freedom to be able to do things I couldn't possibly do on my own. It gives me independence. In this case, it gives me control and entertainment. And I will just play the little video on the right-hand side of the screen. And so you can see the kind of drone footage that I am able to obtain from this little device stacked with an abundance of artificial intelligence. So that's what AI technologies have done for one field of human activity. But if we go back to medicine, what's AI doing for medicine and medical practice? So I've shown a couple of examples here. Robotic surgery. Robotic surgeons in the hands of skilled surgeons allow surgery to be much more precise and accurate and less damaging than that could be provided by even a very skilled surgeon. And to give you another example, the picture on the right is of my partner using a laparoscopic surgery training tool, which provides haptic feedback. And so what she is able to do is to effectively simulate the removal of a gallstone using the laparoscopic tools that you can see in the hand, as you can see what's happening on the screen. And so you have someone who is not a games player, she's got no surgical training whatsoever. But with the ability of AI and AI embedded into some of these other technologies, it allows someone who is relatively, or in fact completely unskilled, to do what would normally be a highly skilled task. But where we're actually going beyond that now today is going beyond AI as an empowering technology to leverage the skill of human beings into technologies which also help to control our health. And I've shown this example here of an insulin pump. So on the left-hand side, you can see a couple of patches on this body with a device. And this device measures the insulin within the patient, and it uses that to automatically provide an injection when it's needed. So for people with diabetes too, having this technology embedded. The picture on the right shows probably a later example of this, and this picture is basically courtesy of Renfrew International. It's a design company, and so you can see that not only can technologies, embedded technologies, add power to human intelligence, they also increasingly are able to exercise control without any kind of human intervention. So when we look at the future of AI in medicine, the question that I want to ask is whether we're actually going to combine the best characteristics of human and artificial intelligence. So are we moving into a future where AI and enabling technologies are empowering and enabling human beings? Or are we moving towards a situation where eventually, even in medical practice, with all its complications, artificial intelligence might replace human beings? And I show this example of a steam train, which is actually younger than I am. It was built in 1951. And in those days, you have technology which empowered human beings, but you needed the skill, experience, training of a driver and a fireman to be able to get the best out of that piece of technology. And so if you were a train driver, as I wanted to be when I was a schoolboy, the attraction was developing skills, the experience, the challenges, the job satisfaction, and the status that having this control over a steam locomotive would bring. And in my lifetime, we've gone from that to the situation on the Docklands Light Railway where there are no drivers at all. And just looking probably at something a little bit more controversial, looking at human intelligence and how human intelligence is used to be able to manage terrible situations like pandemics. This is a couple of images from the Plague of London, 1664, which I suppose would be their equivalent to COVID-19. And in those days, human intelligence was all they had to be able to respond to that. But it's interesting to note that they had a lockdown in 1664. And all of the infected houses had to be locked down for at least 6 weeks. And all the members of the family, whether they were ill or sick, they were locked inside. And this happened all over the country. Not only were they locked inside, they had people wait outside watching the doors to stop them coming out. And if they were allowed to use violence to enforce the lockdown, and anybody found outside in breach of the curfew could be whipped. And if they had an infection, a plague sore on the body, they could even be hanged. So this is how human intelligence was applied to a pandemic back in 1664. And now we have human intelligence, of course, but we also have artificial intelligence being applied to a pandemic. And so a lot of the decisions that are made today about lockdown and the measures that should be applied are supported by artificial intelligence-enabled data analytics. And the question I want you to think about is, what are the consequences of this reliance on artificial intelligence and the interpretation of data? The government currently, and I'm making no criticism or observation or reflection or trying to make any kind of judgment on the difficult situation that we face globally with COVID-19. All I would like to ask is whether artificial intelligence enabled data analytics provides a complete enough picture to enable decisions which are of the optimum benefit to the whole of society. In other words, does the technology, the AI-enabled technology that we have today, take into account the economic effect of lockdown, the effect on mental health and psychology, all of the other things that we hear about on a daily basis on the news? Is this all able to be taken into account when the data is presented that is the basis of the decisions that are being made today? And lots of intelligent people do have concerns about artificial intelligence. And again, as a user of artificial intelligence on a daily basis in my smartphone and on my drone, I have to say that I'm a big fan of AI when it empowers human capabilities. But we cannot ignore the fact that people like Elon Musk and Bill Gates have issued some warnings about the dangers of artificial intelligence when it's not applied in a way that can be under the control of human beings. So we have some very big questions to debate. So in today's world, what's increasingly in this AI-enabled world going to be the role of clinicians and medical professionals? And will artificial intelligence guide, empower clinicians and human beings, or will it inevitably at some point in different ways control or replace human beings in medicine, health and well-being? And if we go even further, and if you look at the concept of singularity, in which human beings have so much embedded technology within them that they become hybrids or almost like cyborgs, is this a prospect or something that we could walk into without being aware? And what part is AI playing in public health policy today? Well, I'm going to stop talking now, and what I'm going to do is to go back to Olly and ask him to share some of his thoughts and experiences of the use of AI within Alphalake and his own work. Olly, over to you.
Thanks, David. That's a very tough act to follow. You've used a very analogous and excellent skill in being able to draw comparisons between things. And I think you've given a better summary than I will be able to, but I will do my best to give you my perspective on what you said. So what I'll do is I'll start by sharing a few slides, just to guide really in terms of my thoughts, but it will give you a bit of a sense of how I see things from in my role as both as a founder of Alphalake and just in general in terms of what's happening in healthcare right now. So I will just share screen, so bear with me. I need to do this in the right way, so apologies. There we go, present, and I need to just escape out of that, excuse me, bear with me, there we go. So I should now be sharing my screen now. Sorry for the delay there. And yeah, so what I thought it would be good to do is just sort of sometimes in healthcare and in any industry, we can get kind of caught up in the terminology of things, and I thought it would be good to break down some of the constituent parts of AI, because I think, you know, I see AI as really a very sort of umbrella term, and I think most people that are involved in it recognize it in that way. We have it in our name, you know, Alphalake AI. It focuses, it gives you a field of focus, and I think terminology ever since, I was thinking about it the other day, since we sort of differentiated between biology and physics, you know, in sciences, you know, we need to have terms of reference, we need to have terminology. It enables us to focus in and concentrate. But there is a concern that sometimes terminology can become overused and misunderstood. So I think sometimes it's quite good to sort of break down how I see, you know, I thought it'd be good to just give an overview of how I see AI in healthcare currently, and what that really means, the sort of nitty gritty, if you like, of AI in healthcare. So I think a lot of it is really around the data, of course. I don't want to spell out the obvious, but if you don't have the structured data, there's little you can do in healthcare, and that's one of the challenges at the moment, in terms of access to good, realistic, modeled health data. I think there needs to be some breakthroughs around that to be able to really take things to the next level, because it's slowing down innovation and slowing down what AI can do in terms of innovation, being able to move forward at pace. It needs to have access to realistic, whether it's synthesized or not, it needs to be a realistic and a large amount of data. So what I thought would be good to do was just sort of break down the actual the components of healthcare. So applied data intelligence. So for me, that's really about being able to use data in a way that, and a lot of what I'm going to say now is really around user experience, which I'll come on to in a bit. But how we can use data, not least in the way you described it, David, to be able to you look at consumerism of healthcare and prevention of being better than intervention, and how we can use some of this now, the amassed data that we have out there, how we can more easily apply that to outcomes that affect both the individual patient but the healthcare system as an efficiency, because obviously you know, that's a big part of it. You know, driving efficiency into the system enables redistribution of funding and budgets, and so, you know, which can then go into hopefully areas that can enable better patient experience and hopefully longer and healthier lives for populations. And we have seen a big shift in recent times, in the last few years, whereas the NHS, as I was always understood it, and as people that have worked in it longer than I have always explained to me, that it was really good at, you know, to just focus in on the NHS, but most sort of healthcare systems are the same, where they are very good at sort of fixing you if you're broken, but there hasn't been as much sort of focus from a national health service point of view in the past around sort of that populational health management and prevention. And I think there's a sort of a wising up to that now, that, you know, the more that is tackled, whether it's through wearables and digital health, you know, sensory tech, and a better understanding between healthcare providers and patients with regards to data, that is driving efficiency into the system. So a lot of this, I hate to bring it back down to the you know, the sort of the brass tacks of business, but, you know, if you can get the finance to be making sense, then a lot of these things can happen more quickly. So I think there is a change now in healthcare, where we're looking at integrated care a lot more across care and health and social care, and we're seeing that with the integrated care systems and the local healthcare records, and we're starting to join up healthcare better. And I see the digital health app explosion and IoT in healthcare being a part of that wider shift. So yeah, applied data intelligence for me is a really big thing, you know, in terms of just, you know, how we can use all this data that's out there, whether it's with, you know, a few years back, I was always surprised that we weren't able to better use things like Fitbit data, and how can that be triangulated to other health metrics better. We're seeing that happen with the likes of Apple Health and Samsung Health. They're becoming the sort of the big sort of players in that kind of aggregation space. But I think as healthcare providers, we can also or as healthcare systems, there's more that can be done there. Process automation, put in brackets there, intelligent with a question mark. I like to talk about process automation. I just talk about, there's a lot of what we do at Alphalake is around process automation. It gets referred to as intelligent automation. We're using, in terms of operationalizing AI in healthcare, there are a lot of sort of feasibility level initiatives happening, but in terms of AI enabled technologies, one of the main areas that we've seen traction is in automation and process automation, and how can we join up the various parts of healthcare and make it more interoperable. And that does have a relevance to AI in another way, but one of the things that is used in that, in the reason it gets referred to as intelligent automation, is twofold really, and sometimes gets misinterpreted or means different things to different people. There is actually some technology that is using things like intelligent optical character recognition and machine learning based bots, essentially, that can process lots of documentation and learn that documentation. So essentially, whether that's paperwork that's in the system and in healthcare, but a digital form of paperwork, hopefully more and more these days. So not actual paper, but paperwork in the broader sense. There's a lot of efficiency there in terms of how healthcare works or a lot of inefficiency, sorry, and a lot of efficiency gains to be had in terms of how healthcare works as a system, and being able to interpret things like, whether it's things like invoices and purchase orders and medical notes and various documents that are passed around during the healthcare in a healthcare service provider. There is now intelligent capability that you can train enough variability, which is why it always comes back to how much data, so that various bots and AI machine learning based bots can actually read a new type of document that it's never read before, because it's being trained enough on the variability of that document. So as I always say, you can see where the quantity column is, or you can see, because it's been taught that that's what, in the same way that you or I, David, would look at a medical document and be able to read the different tables and headings. There's an intelligent component to automation that is enabling that as well, which is to train these systems with enough variability that they can then handle new information, which is really, that in what I've described there is really, for me, a great example of what I really see AI as. It's obviously its ability to handle new information that it's not seen before, but it needs enough variability to be trained on that. And machine learning is really the key one. I think we should probably, if the most accurate way of describing AI is probably just to talk about it as machine learning, because 80% of the time it's really machine learning. There are things like deep learning and neural networks and things like that, but I think that's really for that's the exciting stuff. But as an SME business, I leave that to the likes of Google and the sort of general AI sort of quest. Most of what we see in sort of everyday use is machine learning, and then using that to improve user experience. A classic example is Netflix, which is a simple one to use as a reference. We are guided, to use your excellent question in terms of the binary sort of question that you put to me, David. Netflix guides us on what we want to watch increasingly, and that improves our user experience. It reduces our cognitive load as humans, and normally most of the time it's going to have helped us decide on what film we might want to watch before we even knew ourselves. So it assists us in that user experience. So some of that is, and that's just about data. That's just about simply structuring that data. It's about looking at other people that are similar and have similar tastes to maybe the same film taste that you might have, David. They then use that as a cross-reference to better improve the famously they change what you actually see. So it's not just the screen grabs and the way they present certain films are tailored to your preferences. So if you like a certain style a certain style of film, they might make that more like looking like a horror film, and then the other person looking at that screenshot would see a different version of that same film. So that's something that I didn't realize until relatively recently, that they were doing that with Netflix. So Netflix is a classic one to explain how recommendation engines, which is the thing I was just going to finish on, are being used to guide and assist your user experience. Now, of course, sometimes you might want to choose what you want to watch completely independently from an AI or a machine-based algorithm that's supporting that, and that's an interesting point, which makes me think of how with Google Gmail now it finishes quite a lot of sentences for me. I wondered a few years ago how when I was writing messages on my smartphone, how it was suggesting in the next word that should come in my sentence, and sometimes I would then find myself choosing that word as opposed to the word I was going to write. And that's a very interesting inflection point between machines starting to have arguably some control, if you want to put it like that, over what we are doing as humans. And that's in itself a very interesting conversation, which maybe we could go into in more detail. But I thought it'd be good just to break down what I see as AI in healthcare, to give you some thoughts on sort of, how we're doing that at the moment. This is just a little bit about Alphalake. So I didn't want to really sort of promote, make this sort of a sales pitch or anything, but these are our values that we sort of subscribe to at Alphalake. These are our mission, sorry. And our aim is to intelligently automate healthcare transformation, to build better digital patient experience that delivers consumer grade customer experience. And that CX is a big one, because it's something that we've not tackled very well in healthcare traditionally. I always give the example, you go into a GP clinic and sometimes it feels like you're going sort of 15 years back in time in terms of process and experience, when you've just, as on your walk into the GP clinic, you've just ordered, you left the house ordering something through Alexa telling you what's going to be delivered that day, and you've hey Googled something on the way to the clinic, and you walk into the clinic and the whole process is completely different. It's 10, 15 years sometimes out of date in terms of what's going on in that consumer grade world. So CX, customer experience. When we launched Alphalake, I was talking about digital patient experience and improving that whole, and so we, acronym that as DPX. But we're seeing CX and customer experience as part of the consumerism of healthcare shift, really start to improve and be thought about more in healthcare. So that's one thing that we're trying to do. And then leading the way in data intelligent health and nutrition, which we'll maybe hopefully come on to, and being instrumental in achieving universal health equality or equity, depending on how you prefer to put that. So I just wanted to go into the control or guide, so which was the question you'd put to me, David, for this webinar. And I think for me, it really breaks down to these sort of things that we're seeing. So Chatbot and Conversational AI is another area that we're seeing, which really is all about natural language processing, or NLP. And that is, we're starting to see that creep into our daily lives. I mentioned Alexa and I mentioned Google earlier, a sort of avid user of both, because it just makes my life easier. I'm able to ask Google things, and having that language, that voice interface really just is something that we're seeing. We're seeing ear pewters and a lot of hearing innovation coming out in terms of how we interact with various. So the interface, the human interface with a lot of these services is changing, and healthcare is catching up, and we're trying to obviously help that. But what I really want to talk about was the assisted AI for better human decision making. I wrote a blog recently about I heard it was called Shell Shocked, or Shell Shocked and Shortchanged, and it was about it was because I was watching a BBC News piece, and they'd mentioned Shell Shocked for the people working in healthcare and the nurses and the doctors working on the wards, and it really sort of resonated, and you know, it conjures up images of people, you know, in the First World War, and the young brave men that, you know, that you know, many didn't return. And those that did had a pretty tough time, and it made me think about, you know, how we have been shortchanging the nursing profession, and thankfully there's a lot of things coming through around that now, and hopefully we'll see some lasting change. But the reason I wrote the blog was also about how we can not just help by improving pay standards and things like that in healthcare, but also we can help with technology. We can help by reducing the strain and the burden that healthcare workers are undergoing as part of what they've had to go through with the pandemic. But before the pandemic, it was also a pretty rough deal for some people working in healthcare in terms of, you know, the technology they were using. They weren't benefiting from the information flow, the assisted UX that would help you, guide you, in that Netflix example, in the way that, you know, so we're seeing that hopefully starting to change, and what we're doing at Alphalake is part of that. And, you know, for example, what we're doing is we developed a chatbot in Microsoft Teams that enables doctors and nurses to be able to interact with the different systems and improve their interface with those systems through using a chatbot, and surfacing information more readily, which can be life or death situations, when you know that you know, when information isn't readily available, or you know, doctors or nurses have to go and log into 4 or 5 different systems. And how can AI play a part in that? So once we've connected everything together, AI can then start to give a bit of a guide, give a bit of an assisted recommendation. Now, on your point, David, of whether it will ultimately be the decision will stand with the machine, I think yes. I think we will end up at that point. I think we are decades away in most scenarios. But I think what we'll see for the next couple of decades, if we can try and put those sorts of timeframes on it, no one's got a crystal ball, I would predict that we will see AI playing that assisted role, whether that is guiding you. So if you take, for example, we're working on an opportunity at the moment in dentistry, for AI in dentistry, to help dentists be able to make quicker decisions around image recognition, and that can be pointing 3 or 4 little circles on a X-ray of a mouth, of gums and teeth, and pointing where you need to be looking. That could be image recognition in a radiology department in the hospital, or pointing out, you know, things that the doctor would otherwise have to really sort of strain to see, or you know, take them a little bit longer to understand that. So that's that guidance. That's that kind of showing them it before they still ultimately decide, you know, and communicate back to the patient for now. But I would see eventually the trust building to such a point that the AI becomes, as we've seen in a lot of cases already, more reliable than sometimes the humans, where you've got that structured data. However, there is a caveat for me with that, and the caveat is that if we go too controlled, or the guidance leads to control, we might miss certain opportunities. For me, that can include an example with my grandmother, who has wet macula, as an anecdote to give a reference point. And my grandmother has, bless her, she's 94 years of age now, and she, for a number of years now, has been going in and having injections directly into her eye without any sort of anesthetic at all, and the reason she has that is it keeps her eyesight. She does that because the wet macular degeneration, the black spots in her eye, would be such that eventually she would go blind. And the reason they found out about the way they found out about how to treat this wet macular degeneration and sort of stop it in its tracks was a wonderful accident, and an anomaly, and that was because they realized that in the data they were seeing that people who had diabetes, type 2 diabetes, that were taking drugs for type 2 diabetes, had actually were not seeing the same degeneration. They were not seeing the disease progress, the wet macula progress. So they were able to then join the dots and realize that through an accidental discovery and a pattern, they were able to better treat people with wet macula. And then that is the actual injection that my grandmother receives. It's I forget the drug's name, but it's the drug that people that type 2 diabetes, one of the drugs that people with type 2 diabetes are prescribed. And that wouldn't happen if we don't allow for discovery, so we need to be careful that we don't go so controlled over the coming years that we don't allow for because all the best, whether it's an apple landing on Newton's head or whatever, from that day forward, the best discoveries in history have been and in healthcare come from the unexpected places. They come from the outliers, they come from the anomalies, they come from finding something that you weren't looking for. And we just need to be careful. That'll be my one sort of takeaway for this presentation, that as we move to more control, more accuracy, that we leave room for being able to spot these unexpected patterns in data. Prevention better than intervention. I think that's fairly self-explanatory. I just wanted to touch on one other thing, which was how I think it's an interesting parallel between holistic healthcare. We for a long time have seen the dualism of Descartes and 400-year-old theory that and I read this wonderful book, which is why I thought I would draw reference to it, by Edward Bullmore, which is The Inflamed Mind, which really is able to and I heard it on Radio 4 and ended up just thinking it was a fascinating exploration into our current sort of treatment for how we've been throwing pharmaceutical, drug industry has sort of geared up around SSRIs and various depression medication, and he really sort of pulls that apart. But the main thing that the book is about is looking at how we have for a long time in healthcare really looked at things in quite a siloed way. The disciplines of healthcare, which are important because then someone can become a specialist in a certain area, and understand. An oncologist can become an oncologist and understand it to an advanced level, and an orthopedic surgeon can become so these specialisms are important, but we're realizing now that as the body is so interconnected, more functional medicines and holistic sort of view of healthcare is coming through. And I see a lot of what we're doing is applying science to sort of previously understood old wives' tales, or whatever you might want to call it. That a lot of the things we've known about for a long time, we're sort of using data and science to sort of take them to the next level. And so I just wanted to sort of mention that book, because what it really talks about is, and what I find interesting is, as healthcare becomes more holistic and we understand that everything is interconnected, including the dualism of the blood-brain barrier, and really sort of goes into, that book goes brilliantly into the immune system and what about looks at inflammation, and I won't do it justice, but I recommend it. It's a great read. I think what we're seeing as well in healthcare is the data interoperability and the data becoming more connected as departments of healthcare and different disciplines in healthcare connect more. We're seeing the system of healthcare connect. So I think that's to be expected at a macro level, but it's an interesting parallel. And the only final thing I was going to mention really was around triangulation of data and how I think that one single piece of data is no use to anybody. Seeing someone's exercise or seeing someone's nutritional intake is not very helpful unless we understand their feelings and the symptoms that they're presenting with, and then we can start to triangulate and look for those patterns that we can't currently see. So I'm a firm believer in the sort of quantitative self, and I think we will reach a point where we will see patterns that we're currently just not able to see as a result of improved data intelligence. And that's something that we're working on with our NutriX project, which is to hopefully, if we get it off the ground, and which something we've been working on for a few years now, will be to actually enable us to see nutrition on a level that we've currently never seen before, by improving the user experience of the of tracking nutrition. I think we'll be able to spot patterns in the triangulation of our nutritional intake at a micro and macronutrient level with various other diseases or healthcare symptoms as they present. So I think, you know, that's just as I see the future. And conclusion, I would say, I think assisted accuracy on the example you gave of your partner, David. I think it's really assisting her to reduce that human cognitive strain. I think we all make our best decisions when we are when we're stress-free, when we're able to think and solve problems. And I think in healthcare at the moment, a lot of doctors and nurses are going through the opposite to that. They are under constant strain. The technology isn't supporting them in the way that it should. And I see AI and technology and AI assisted user experience with those recommendation engines, you know, bring in the sort of the DNA, if you like, of Netflix in a very basic way to describe it into healthcare. I think we'll see people be able to make better decisions with less strain, and help and bring in that, as we say in Alphalake, you know, returning that sort of returning humans to human care. And ultimately what that's going to lead to is semi-autonomous healthcare, where the human sort of is involved in nudging the healthcare treatment along, and talking to the human. And I think we'll see more of a, hopefully, I think we'll see more of a return to the family doctor, to continuity of care. And I see technology being, I think that's one of the best things that we can get out of technology, which is that human relationships in healthcare can come back to the fore, and technology can allow the system of healthcare to move along in a semi-autonomous way, much like a Tesla car would, to use a car analogy, like yourself, David. And then finally, I wanted to just sort of touch on something that I saw yesterday. It's not particularly related to healthcare, but it just, in my hometown of Northampton, and I posted this yesterday. I was running around the park at lunch, and I saw these little bots, these little robots, going along the pavement, and I'd seen them being released in Milton Keynes on the news, and they're now the second city that the company Starship Technologies have rolled out is Northampton. And we've got our lunch turning up in a moment with in one of these, so I'm going to be the first user of it. And I just thought it would be a nice thing to end on, to talk about, you know, we are at a time in the world where, you know, some really exciting things are happening, and I just think we need to make sure that we channel that in healthcare. And this is using machine learning. It took a while for that little robot to pass the driveway and to cross the road, but it's pretty impressive. I watched it for a while, and they get the delivery to you within an hour. So it's not directly linked to healthcare, but it's using some pretty impressive intelligence and AI to deliver a very impressive service. So if we can take that thinking into healthcare and AI in healthcare, then I think we'll be in a very good place. So that would be my the future is exciting. So let's yeah, and yeah, that would be how I'd finish, I think. Thank you, David.
Okay, if you could stop sharing now. Okay, so we're back. Thank you very much for that, Ollie. I'm sorry we're not going to have time to have much of a discussion, but I just would like to make one or two observations. I think that everything that you have talked about, that your work with Alphalake AI is very admirable, and I think that you're providing examples of how AI and technology can empower professionals in the medical industry to improve the kind of care that the care levels and service levels that people get from outside organizations like Amazon. So I don't dispute any of that. And anything that you can do with process automation, anything that you can do to provide decision support to professionals that provide a much better user experience, then is to be exalted. And I have to say, using an example, myself, we have my partner's father, 96-year-old, living with us. He has multiple health problems, multiple medications, and I have to say that the quality of care that he has had from Northamptonshire Health Services has been exceptional. And I want to use this as an example of how human beings will have an advantage over artificial intelligence, I think, into the foreseeable future. It's because the care, the empathy, the desire, the ingenuity, the creativity that human beings in a relationship with another human being, i.e. Jackie's father, these are things that could not be delivered by an AI-empowered robot.
Exactly.
So I'm all for all of the things that you have said, but the observation that I would make, and this is where I have some real concerns, is the fact that AI and enabling technologies are transforming society in ways that are not necessarily good for human beings. You talk about the reduction of the cognitive strain, and certainly with a lot of healthcare professionals today, that's really, really sorely needed. But if you look at life today, and I use the train driver as an example, I believe that human beings need to be challenged. They need to have situations where they can use their skill and their expertise, whether it's enabled by technology or not. There is in human development a necessity to have these kind of daily challenges. And one of the reasons why I think we face the challenges with lifestyle related health conditions is because of the use of technology in our lives is taken away a lot of the cognitive and physical demands of life, and consequently this is leading to some of the conditions like obesity and diabetes, which are chronic medical problems, and they're not going to be solved by artificial intelligence. It may be, or it certainly will be, I think, that the combination of wearable devices and an understanding of human behavior will lead to influences in our lifestyle choices that will improve healthcare. So I do have some serious concerns about AI generally. The other major concern that I have, and again, it is not meant to be criticism of anybody's handling of the pandemic, because I certainly wouldn't like to be in a situation where that I'm having to make decisions that will affect the future of millions of people within the country, which is what the government is having to do. But I cannot help but reflect on the fact that they are basing their policy on and strategy on advice which comes largely out of the use of technology to be able to simulate and predict the effects of a pandemic. But the data that is providing takes no account of the collateral damage of lockdown, of a range of other things which damage the economy and mental health. So it's a really one-dimensional decision-making approach. Artificial intelligence and the technology cannot possibly take into account all of the other parameters which are really critical about what the likely outcome for any community, any country in future is likely to be. So that would be my main criticism. I don't know whether you want to make any more comments while I just have a look at the Q&A to see if there's any questions. There's more observations from Carl Bridge. There's one or two things in the chat column. David Levin talks about chatbots and the empathy that chatbots can provide. Increasingly, human intelligence built into to chatbots, and you, whether it's chatbots or whether it is the kind of use of AI and technology in the, for example, the 111 service. When you dial 111, there's a lot of AI-enabled decision support that, even though it's a human being answering the phone, they are guided by a process which is essentially controlled by AI, and it's designed to be able to basically triage patients and then make sure those who are in most need of urgent need are dealt with, and other ones. So there are some fantastic uses of AI enabling technologies with digital medicine. I just would like people to think very broadly about the overall impact of AI in the sense of the impact of
society
on society and
yeah,
of humanity in general.
and I think that's a really interesting point there, David. I think I see you know, on that sort of healthcare side, the healthcare provision, I see, you know, technology as doing the bit that technology should do, which is initially, let's get some of the basics right, which is let's get the communications between patients better. Let's not have you know, people having to, you know, get on being stuck in a telephone queue for half an hour at 8 a.m. every morning to just book an appointment with their GP. Let's get communications properly digitalized between patients and GPs so that they are more included in their healthcare service. Let's get some of those basics right, and technology can do a lot of that. The interoperability, you know, connecting healthcare more. Once we've got that in place, what on a more societal level, you know, using AI and essentially what I think you're talking about is really being able to sort of being mindful of the fact that we don't want to make the population sort of too dumb, for another way of putting it, that it loses its endeavor, and I think for me, as long as there will always, I think there's always going to be people that will just take advantage of, you know, I think this talks to automation and jobs and things as well, you know, in terms of, you know, what's going to happen as we go through this, you know, industry 4.0, or as we're, you know, so often told that we're in, you know, what's going to happen with the spare capacity. I wondered a while ago, are we going to, you know, as automation takes more of a grip, are we going to, you know, use that spare capacity to change and adapt our lifestyles so that we can go and be more, you know, artistic, more creative, study more, learn about the human condition more, enjoy times with our families more? Are we going to use it in that way, or are we just going to chase the dollar and we're going to just, you know, try and push for more GDP? You know, I think, you know, that's an interesting point. And it makes, your point makes me think of that, like, as technology starts to work as a machine, what are we going to do with spare capacity, whether it's spare mental capacity, as you were talking about, David, or whether it's just spare capacity in terms of our need to work in the way that we have worked previously. I think we go through these changes, and history is always, you know, technologies on automation, and now AI, or just an advanced level of automation and decision making. I think we as humans will always have human endeavor, and if that human endeavor means that we go and explore space more, or hopefully solve health equity, and use those sorts of the repurposing of human effort can be put to good, I think. And I think as long as we do that, then there's a lot of other problems we need to fix, whether it's just equality in the world, or space discovery, or disease, conquering of cancer and things like that. So there's lots still to be done that humans are still going to be a big part of, and if we can redistribute that human effort and that human mental capacity and time, then I think we could be hopefully there's positives in this, would be what I would.
Well, Olly, I thank you very much for your observation. I think it's a very good way to close our discussion today. Thank you very much for joining me this afternoon for all the work that you're doing. And in particular, what comes across to me very well is your commitment to do something to make the world that we live in a better place. And that's much appreciated. So I thank you for joining me. This webinar has been recorded, so I'm going to be posting it in various channels, LinkedIn and YouTube. It's also been live on Facebook, although I've obviously not been monitoring that whilst that's been going on. Just a final thing to just share with you as we draw to a close, and that is just to, and you did mention chatbots, so I thought it was appropriate just to share with you an upcoming event, which is next week. It's next Thursday on March the 11th. And it's an IORMA webinar, and it's on chatbots, virtual humans and consumers. And I think it will cover a lot of the things that you've been talking about in terms of process automation and improving the user experience. So this is on next Thursday, March the 11th at 2 o'clock. You can find out more at the IORMA website, www.iorma.com. I will be there because I will be hosting the webinar in the background, and I hope very much that you and anybody who's joined us today will be able to join that session. And so without further ado, I'm going to now bring our webinar to a close, and just thank you, Olly, and also thank all of our delegates and participants for joining us. So thank you once again.